tennis ball, lacrosse ball. So we're gonna move up to the wall. So I like to suggest to my clients, if gravity in your body weight is a little too much for starting off, always use the wall first. So for the ball and the wall, a good place to start is gonna be kind of where we were working with the foam roller. So you can get it kind of in between your shoulder blades. So you can see in the diagram too where the trapezius starts. It'll be down here a little bit further too. So it doesn't hurt to kind of go that whole length of it. I mean, the lats are pretty broad to the side, so you can do that. But broad muscles, I like to kind of stick with the foam roller. For some of the like nitty gritty stuff, I like to use the ball, the smaller surface area. So in here, you can roll up and down. This gives you a lot of space to be able to retract, kind of create a little bit of a hollow area, kind of where the lip of your scapula is. And then you can kind of broaden it out, hollow it out. So moving that shoulder around where it just feels comfortable for you, where it feels kind of organic. Some areas, when you're doing this, might feel a little, I don't know, sour. That's how I kind of call it. Feels kind of acidic. So there might be some, in tight areas, tight fibers, it almost creates like a traffic jam of metabolic waste, muscle exhaust. And so there's not a lot of blood flow in the area. The tissues are really bound up and tight. So doing this, kind of moving the fibers around, broadening it out, it's like kneading dough. You're just kind of stretching it all out. And you're just getting more circulation, blood flow into it. You're flushing a lot of that metabolic waste out. And you're also getting a little boost of endorphins too that kind of help with pain relief. You might not be getting as much oxytocin as if you were coming in to see a massage therapist, but this feels pretty good. So now I moved from in between my shoulder blade to now I'm out into the rotator cuff. So like you'll see in the diagram, I'm kind of on the infraspinatus right now. I'm on the top side of the outer side of the scapula. Rotator cuff. So you can move that shoulder around and get in there. Moving into the delts a little bit. So my favorite area though to use the ball is going to be on the corner into the pecs. So normally this is good because you can kind of move past the wall, right? So you put that kind of in the front of the shoulder and then you can lean into it further too. You can move this arm up and down. Sometimes I just put myself in timeout in the corner. Just, No, this feels good. Yeah, so hitting the pecs in the front. You can kind of, I don't know, sometimes with like my biceps and my triceps, I mean, sometimes I can do it on the wall. Sometimes I like to do it on a counter too. But yeah, so triceps, biceps too. So that's kind of using the ball in those areas around the shoulder. That has worked well for me. So now we're going into some specific stuff here. This stick. So some of you guys might have seen this back when I was doing a psoas release. So the psoas is a very powerful, deep hip flexor. Well, the subscapularis is a deep, strong kind of rotator cuff muscle. The way that I get into this muscle is to actually go kind of into the armpit. I know some of you are going to be a little bit ticklish in this area, so you might want to ease into it. So you can do it up against the wall, but what I found is that's actually better is having something that's a little bit more forgiving of a surface. So actually the couch or the bed actually would work pretty well for this. So it feels pretty stable in here because it's got like a lot of that cushion, right? This way you can also hollow out your shoulder to get into this subscapularis, really important shoulder muscle. So you just hollow this out, get it right into your armpit. And again, you'll see in the diagram, it's on the underside of the scapula. But this is a really important muscle. So you can kind of breathe into it and then rotating your arm around. You can even mimic like a throwing motion because that's what the subscapularis helps you do, is do that internal rotation. So this one is going to be a good one to do if you do have some restriction going above over your head. This is tight and it's locking it down, it's anchoring it down. It's going to force a lot of these other muscles to work harder to get past that limitation. So a lot of people will say they're very sore and tight. They feel pain and ache running through here. But this might be a symptom of all of this being locked down. So this is a good spot to go after. So the stick there, another one where this can come in handy, we're going to take you down to the floor again. This one's going to be for the upper trap. Okay, so finding a corner is a good place to be again. So what I'm going to do is I want to try and release this upper trap and levator scapulae. These muscles are connected to the top of the scapula, and that helps you shrug your shoulders. So a lot of people will say that they hold a lot of tension and a lot of stress up here. They're ear muffing with their shoulder. So to release this guy, I like to get the stick right up in this muscle, and then I'll kind of creep up my hip and my heels down here, and then I'll just push up into it. So you can control how much kind of relatively downward pressure that you're getting into this muscle when you're pushing up, pushing your body into it. So from here, I like to do some movement. I like to go ear to shoulder. I like to look and rotate side to side. And then, I mean, going back and forth doesn't do much, but it's kind of in those two planes of motion. The frontal plane here, and then the transverse plane here. Frontal plane just means you're going side to side, thinking about windshield wipers. And then transverse plane is rotating. You can kind of do in between. You can tilt your ear to shoulder and then rotate your head up and down. So this again, is going to be a spot where there's going to be quite a bit of scar tissue, adhesions, knots, gunky, junky. Bleh. It's going to probably feel a little like stingy, sour, acidic. It's not going to feel that good, but it's also going to feel really good. It's one of those hurt so good areas. So this one is the one that I highly recommend for sure. You can focus on moving the head if moving the shoulder hurts too much into it. But I also like doing stuff moving the shoulder as well. I think you can get at it better if you just move your neck, but doing both definitely does not hurt it. So that's a good one to do. for the upper trap and the levator scapulae. So that's the stick. Then we have some other mobility stuff. So going back to kind of the basics that we were doing with the foam roller, the connection with the thoracic spine and the scapula, that floating joint, right? So getting the thoracic spine to move a little bit. I like doing this basic 3-way mobility exercise for the thoracic spine of the mid-back. So you find your elbows, you clasp them with your hands, and you'll go in all 3 planes of motion. So the first way that you would move would be forward and back. So the focus here is bringing the attention to the mid-back, right, to the mid-back here. So you want to focus on moving each vertebrae independently of itself, right? So you don't want like a whole chunk of it to just, hinge over like that, right? You want it to move each segment at a time, right? So you want to get that mobility forward and back, breathing into it. Now we're going to do the second motion, which is frontal plane. So this is that windshield wiper movement from side to side, moving each segment independently again, getting that mobility. And then the last motion, this is where the clasping of the elbows is really important. This is what will take kind of the arms out of it and really focus it in on the mid-back, on the spine. So then you're going to be twisting to each side. So this is that horizontal, that transverse plane rotation. So this one, again, focusing on the mid-back, each segment moving independently. So if I didn't clasp my elbows together, what it would look like is, oh look, I can go that far. But it's because I'm kind of swinging my arm back and I'm letting my shoulder and shoulder blade do it more, instead of finding the motion specifically from the mid-back. And that's as far as my transverse plane of the thoracic spine will let me go. So that one's a good one to get some mobility there. And then again, kind of working on the neck muscles. I mean, you could probably work on these all day for some of us. So one of my favorite neck stretches that I like is, I don't know, the chicken wing? I don't know. So if I want to focus on stretching this side, I'll take this arm, bring it back behind me, and then I'll take my other arm and I will clasp this wrist and pull it in. Okay, so it'll look like this from the front. So you get kind of this triangle, this chicken wing, on the opposite side of the side that you want to stretch out. So what you're doing is you're pulling this wrist down, you're anchoring the shoulder down to get a deeper stretch. So from here, you'll go ear to shoulder, and you can see this lengthening here. This is where the stretch is focused on here. So with your breath, you want to maybe look up, maybe look down. You'll feel it in different lines of restriction. So you can go as far as you can kind of let up, kind of move into it. But yeah, that one's a good one, and then you can switch. So that one, I'm just clasping my wrist back behind me so that when I'm stretching this doesn't happen, because that's not really that useful. Okay, so do that on both sides. So that's a good stretch there. Just some mobility again. You can just do some shoulder rolls back and forth. Very simple, basic. It's like people probably do that intuitively all the time, right? Just like, oh, yeah, getting ready. But that does help. It does get some mobility in there, blood flow, movement. So then another kind of dynamic movement one that's good is just swinging the arms, right? So getting some movement here, bringing it up shoulder width apart. And then making sure that each time you're crossing your right arm above, then your left one above. And then, moving backwards. And you're going to feel that, like we were talking about last video too, that myotatic reflex, where you go out and the pecs are like, nah, don't go back any further. So it'll want to stop you and it might contract and kind of pull you forward. So don't try and like lazily override it and swing back forcefully, right? Just be kind of gentle with it. So that one's a good one. Another kind of swinging one, kind of mobility in the shoulder capsule that I like is called the Pendulum. This one's a nice, gentle one to do. But like find a table, couch, chair, or something where you can kind of lean forward. I can even do this even. So this one's not going to take a lot of work at all. Like it's the opposite. It should be super easy. But you just kind of like lean forward and then you let your shoulder just hang, your arm hang. And then from here, you're almost using like your body to get it. So you're just doing kind of like a pendulum. And so you'll just go in kind of circles. You can go in the opposite direction. But this is a really nice gentle one to do too for the shoulder if it's just really aggravated and it doesn't want to move very well. So that one's a good one. And then some other ones around the shoulder. So this is going to get a little bit more. We've been focusing a lot of the forward or the front attached muscles of the shoulder. In the back, you can do the simple kind of across the body. If you want to do this one a little more active, isolated too, with the opposite hand, right, that you're using to guide it, to assist it, you can resist against it and then relax into a little bit more. Resist and relax. Again, I like a lot of movement, a lot of different angles, so you can do it lower, middle, higher. That one's good. If you want to go a little bit more into the tricep, then you can do just this basic tricep one, right? Same thing, you can do this one a little bit more active. You can take your opposite hand, right? And you can kind of resist against it and then pull it in deeper. Resist against it, pull it in deeper. Again, you don't want to overdo it on this one. So that one's a good one. And then this is an interesting one that I found, but I kind of like it. I think they call it the bat wing. So you'll put your hands kind of behind you here, and then you bring your elbows forward. So you'll feel an interesting stretch kind of in the back of the shoulder. And if you want to get a little bit more resistance against it, you can slide your wrists kind of into the side body, and you can tuck it on the inside of your knees. You can put a little bit of resistance with your knees in it, and you can get a stretch on the outside of your shoulders. This one you can kind of hurt yourself, so just be easy with it. Another one you can kind of hurt yourself with too is like the prayer hands behind you. So this one, I'll just kind of show you like this. And it's a little bit difficult for me to get into it, but so doing this here. You can do it up. You might be just okay doing it this way too. Then there's also one that's called the cow face stretch. This I think most people have an easier time doing it one way than another way. So I think mine, I can get it, if I do it this way. This is like a shoulder stretch, but I can't get it the other way, so you can take a towel, you can take a band, and you can kind of use this. If I can find it. And just meet where you are, right? Just go where you're able to work. And so I can kind of choke up on it a little bit to get some stretch here. So that's a good one for the shoulder. One of my favorite stretches for the shoulder, because again, we're usually restricted and pulled forward. So I like to focus on releasing the front, or lengthening the front and then releasing the back mostly, right? So another kind of anterior shoulder stretch that I like to do is the three-way, or I do a four-way pec stretch. So I'm going to show you just kind of at an angle, but it is good to have a corner. So you can have your arms stretched out, but I kind of like to shorten up the fulcrum a little bit and just use my elbow. So what you'll do into this corner is you'll kind of go low and step into it. Pretend like I'm actually going through the doorway, right? But I'm just going to show you coming this way. So you're going to go a little bit low, straight horizontal, a little bit high. This is the one that is my favorite. You'll go straight up next to the doorway. The doorway frame is going to go right up into your elbow, and you're just going to walk through it with your arm just right next to your ear. This is going to stretch your lat and your subscap, that really important rotator cuff muscle. So that's going to be a good one. So you're just kind of like walking through the door frame to get that lengthening here. You can do a little bit of that active again. You can resist it and then relax into it. Resist it and then relax into it, okay? So it's a 2-second resist and then relax into it. So then a good one to end off with, I like, is gonna be a real simple one and a real relaxing one. So we're gonna come back down. Okay, first we're gonna do thread the needle. So you're gonna be kind of in a tabletop position, and you're gonna take your arm and go underneath. So you can stretch this arm out if you want to, wherever feels comfortable for you. If just going here is enough of a stretch, right, you can stay here. And then kind of reset and come back. If you want to do kind of the whole thing, you can swing out to get this kind of external rotation with movement in the spine as well, and then go underneath. Stretch it out, and then you can even lay down into it. So any variation of that, wherever is comfortable for you, is good. And then a good one to end on, one of my faves, is child's pose. If this feels good for your knees, you can do this. You can kind of go wider too if you want to. But you'll just kind of lean forward here. You can do your forehead on the floor if you want to. Wherever you want to meet that resistance and just be kind of gentle with it. You can reach to one side, stretch out. You'll feel this. And if you go to yoga a lot, they'll say you'll feel this in your side body. Not trying to make fun, but that might ring a bell, right? So you want to feel the side. So this is going to be your lats, your serratus anterior. You'll feel a little bit of the infraspinatus, maybe your posterior deltoid. So kind of push down into it. You might feel a little bit of your subscap, which is really good. So kind of lean down into it. Breathe again into the center and then to the other side. So in any of those stretches, any of those moves, if kind of moving and wiggling around in it where you feel a good stretch, you want to stay there for a while, go for it. Those were a run through of my favorite stretches mobility, dynamic, active, isolated stretching, foam roller, stick, ball, myofascial release techniques to hopefully open up the shoulders a little bit and give you a little bit more relief in that area. Hope that helps. Are we done?
Yeah.